Hello, student nurses! This is part 2 of the ready-made answers with Rationale. If bago ka lang dito, my name is Resty and I help you pass the board exam. This is part 2 guys kasi I already made the part 1. Check nyo na lang yung playlist dito. So I'm gonna help you pass the board exam. At ganito yung ratings ko guys noong last November 2021 at alam kong hihigitan mo pa yan. More than my scores. Okay, let's proceed. Number 1. A nurse is teaching a client with newly diagnosed hiatal hernia about the measures to prevent the recurrence of symptoms. Which statement would be included in the teaching? Would be included. Okay, ito yung tanong ha. Hiatal hernia. Ano ba yung hiatal hernia? Okay, so ang hiatal hernia guys, ito yan. Parang merong bulging of the parts ng stomach. So, nakita nyo yung normal, di ba? Esophagus, diaphragm, stomach yan. Yung normal, walang bulging. Pero nakita mo yung dito sa gitna, sliding hiatal hernia, parang nagbabulge. Yun, umaapaw siya sa diaphragm. No? Kita nyo yung diaphragm, yung red. Yan, umaapaw siya dyan. So, hernia yung tawag. Tapos, meron din paraesophageal hernia. Ito yung sa dulo. So, ang hernia is bulging ng part ng stomach outside of the diaphragm. So, ano yung kailangan natin teaching dito? So, the answer here is be sure to sleep with your head elevated in the bed. Bakit? Kasi during hiatal hernia guys, di ba may bulging na ng stomach? So, kailangan naka-elevate yung head ni patient when resting or when sleeping para ma-avoid yung gastric reflux. Para ma-avoid yung umapaw yung acid pabalik sa katawan. Kasi masakit to guys. So, kailangan to siya i-prevent. Okay. Hope that helps. Number 2. A nurse is providing post-procedural teachings after a client undergoes upper GI series. The nurse reminds the client that the stools will remain white approximately. So, before natin mag-proceed guys, ano ba yung binibigay sa upper GI series na test? Tandaan guys ha, yung upper GI series is a test. So, ito yun. Yung binibigay kasi is barium dye. The barium dye is, ito yan, barium, white, chalky substance siya. So, kaya, ito yung image niya guys. So, pinapainom yung pasyente ng barium swallow or yung barium dye or ng barium contrast. Maraming name yan guys, huwag kayong ma-confuse. Para, if i-x-ray yung pasyente, makikita kung saan dito yung may mga abnormality. Diba? So, yan yung nangyayari. So, yung health teaching natin dito, kailan maglalast yung barium dye? So, sabihin natin sa pasyente, 1 to 2 days. So, magiging puti yung tae niya or yung feces niya, 1 to 2 days. Okay, so, increase lang yung fluid intake dito, at saka hindi na siya mabigla if white yung poops niya. Okay? Number 3, a client being seen in healthcare provider's office has just been scheduled for barium swallow the next day. The nurse writes down which of the following instructions for the client to follow before the test. So, magbibigay ng barium swallow. Ano yung instructions before? Ha? Tandaan to guys ha. Keywords are very important sa board exam. Okay, so sabihin mo lang sa pasyente, remove the jewelry before the test. Yun lang. Additional, remove din yung mga dentures, yung mga rings, lahat ng klase ng jewelries. If yung pasyente, halimbawa, may metal sa body niya, for example, na fracture siya before, so may metal, i-inform lang yung doctor or yung radiologist. So, tanda to guys ha, before, always remove the jewelry. No? Rationale, x-ray yan eh. So, parang maka-counterfeit or parang error yung tinatawag dito results. Number 4. A client is admitted to the hospital with acute viral hepatitis. Which signs and symptoms would the nurse expect to note based upon this diagnosis? So, acute viral hepatitis, guys. Ang early symptom ng acute viral hepatitis is fatigue. Fatigue, okay? Or weakness, body weakness. Number 5. A postgastrectomy client is at high risk for hyperglycemia related to uncontrolled gastric emptying of fluid and food into the small intestine. Dumping syndrome yung tawag dito. Because of this risk, the nurse plans to monitor the... Okay, tingnan nyo guys, sobrang mix yung cases dito, no? May postgastrectomy, tapos may hyperglycemia, tapos may dumping syndrome pa. 'Di ba? Parang ang daming cases. Pero, kung babasahin mo talaga, yung point lang naman dito is focus talaga siya sa high risk for hyperglycemia. Kasi yan yung in-underline ko talaga. So, ganito guys, mag-tackle ng exam answers ha, ng questions pala. So, post-gastrectomy. Tumi, ectomy. Oh, tignan nyo guys, ectomy. Gastro is chan. Ectomy is removal. So, removal of the chan. Okay, so yung problem dito na i-focus natin is hyperglycemia. So, with hyperglycemia, ano dapat natin gagawin? We need to monitor postprandial glucose readings. Postprandial, 'di ba? After kumain. Blood glucose readings. So high risk na to, guys, no? So kailangan talaga gagamitan siya ng test. Ano yung ginagamit? Yung sa glucometer, pwede. Right? Postprandial, after kain. 6. A nurse is reviewing the record of a client with Crohn's disease. Which of the following stool characteristics would the nurse expect to see documented in the record? Crohn's disease. Ano yung nangyayari pag Crohn's disease? So ito siya guys. Crohn's disease is affected dito yung large intestines or tinatawag na colon. Colon, large intestines. So ano ba yung first of all, ano yung function ng colon? So the colon is responsible for the absorption of water and nutrients sa body. Tandaan yan guys ha, with the function itself, malalaman mo na kung ano yung characteristics ng stool. Sige, so ito yung nangyari. 'Di ba may transverse, descending, ascending, colon. Okay, so nakaka-affect talaga siya sa colon guys, yung Crohn's disease. So dahil ang colon, ang function niya is it absorbs nutrients and water. Tingin mo, ano yung stool characteristics, guys? Kasi hindi niya na ina-absorb masyado kasi nga nag-i-inflame na. Ano na yung ano tawag dito? Yung large intestines or yung colon, medyo may palya na. So ano yung mangyayari sa water? Hindi siya ma-retain. So ano yung characteristic ng water? Ng stool, I mean, diarrhea. Of course. Diba? See, when you understand anatomy and physiology, guys, maging easy sa'yo yung mag-rationalize na mga bagay-bagay. So, with Crohn's disease, yung characteristic ng stool is always with watery or diarrhea. 7. A post-gastrectomy client who is being discharged from the hospital tells the nurse, "I hope my stomach problems are over. I need to get back to work right away. I've missed a lot of work and I'm really behind. If I don't get my act together, I may lose my job." Based on the client's statement, the nurse determines that at this time, it is appropriate to discuss. Okay, this is a very classic psychiatric question. No? Yung mga ganito guys, yung mga expression of feelings. So, based dun sa sinabi ni patient, mafe-feel mo na talaga na meron siyang anxiety tsaka nasa-stress siya. So, ano yung sasabihin natin sa pasyente dito to discuss? We need to discuss about reducing stressors in life. Dagdag ko lang, stress is the number 1 contributing factor of cancer according to studies. And if you read more about, guys, if you search more about yung mga diseases guys from the body na hindi maintindihan ng mga tao, even ng mga scientists and even ng mga healthcare professionals, bakit ganito, most of them concluded na stress is the number 1 factor ng mga diseases. Kaya we need to regulate our stress in life. Yun lang. A nurse, number 8. A nurse is providing medication instructions to a client with peptic ulcer disease. Which of the following represents correct information given by the nurse? Okay, so peptic ulcer disease. And yung tinatanong dito, ano yung tamang sasabihin mo sa pasyente? So first of all, what is a peptic ulcer? So peptic ulcer is caused by H. pylori. Ito yung bacteria ha. H. pylori, Helicobacter pylori, or too much nakakainom ng NSAIDs. Ano ba yung NSAIDs? Non-steroidal anti-inflammatory drugs. Usually, mga ibuprofen, yung mga painkillers, mga NSAIDs yan. So, ano yung nangyayari? Yung stomach lining, di ba, acidic yung stomach, guys. So, minsan yung too much acid sa body, ini-erode niya na yung lining ng mucosa, pati ng stomach, kaya nagkakaroon ng lesions or ng tawag dito, sugat. So, ito yung ulcer is yun yung tawag sa sugat, di ba? So, affected din yung part ng duodenum or ng first part ng small intestines. So, ang sinabi dito is medication. Ang tamang sagot dito is cimetidine tagamet. Results in decreased secretion in stomach acid. So, bakit cimetidine, guys? Tandaan, peptic ulcer is caused by overstimulation of acids which leads to erosion of the mucosa or part ng gastric part. Kaya, as a nurse, ipoprovide natin yung gamot na magpapareduce ng secretions para hindi ma-hapde at hindi ma-erode masyado yung lining ng stomach. Number 9. A client complains of stomach pain 30 minutes to 1 hour after eating. Tandaan to, guys, after eating. The pain is not relieved by further food intake, although it is relieved by vomiting pag nagsusuka, and a gastric ulcer is suspected. Okay. The nurse should gather which of the following additional supportive data for this diagnosis from the client. So, paano natin malalaman na gastric ulcer talaga to, hindi to peptic ulcer? Okay. So, let's compare. Ito na. I-compare natin yung gastric ulcer and duodenal ulcer or peptic ulcer. So, gastric ulcer, guys, tingnan nyo. Pain after food intake. Tandaan ha, di ba? Sumakit yung tiyan ng pasyente 30 minutes to 1 hour after eating the food. So, gastric ulcer yan. Pag duodenal ulcer or peptic ulcer, pwede rin. Pain before intake. So, ibig sabihin, pag humihilab ang tiyan na masakit, tapos kinainan mo ng pagkain at na-relieve, naging okay yung pasyente kasi kumain na siya, peptic ulcer yon or duodenal ulcer. So, i-ask mo ang pasyente if he has a history of alcohol use, smoking, and weight loss. So, tinanong mo siya, Sir or Ma'am, may nagsasmoke ka ba dati? May hili ka ba uminom? Tsaka, grabe yung pagkapayat mo? Sabi niya, yes sir, ganun. Tapos, masakit yung tiyan niya after eating. So, okay, gastric ulcer niya. Last number. A nurse is providing dietary instructions to a client with peptic ulcer disease. Balik tayo sa peptic ulcer. The nurse tells the client to diet. Okay? Peptic ulcer. Ano yung dapat na sabihin natin sa pasyente? Yan. Ito lang. Usually kasi may specific diet, di ba, guys? Pero binasa ko, wala naman nakalagay doon. You can eat anything as long as it does not cause or aggravate pain. Yun. Pero, syempre, if nasa choices yung balanced meal, pag sinabi talaga na eating a balanced meal like fruits, veggies, and food, ito talaga yung the best answer. Pero if wala naman at nakalagay lang to, eat anything that does not aggravate pain, it's okay. Pero pag sa dalawa, what do you think is the best? For me, ito, yung eat anything that does not cause or aggravate pain. Pero kasi wala naman definite na answer dito eh. And that's it. Thank you so much for watching. Please don't forget to like, comment, and subscribe to this channel para ma-motivate naman ako, guys. See you on the next videos.